Welcome to ADHD Realities. I'm your host, Leanne Borneman, sexologist and certified sex therapist. Today, we're talking about hypersexuality and all the crave and rave around ADHD. Is it really an ADHD thing? Let's unpack. I want to talk to you all today about one of the more popular topics in literature when it comes to ADHD and sexuality, which is, drumroll please, hypersexuality. Okay, so I definitely have a love-hate relationship with this topic, and so I'm going to do my darnest to discuss it in a as professional as possible with a few curse words in the mix. But when it comes to hypersexuality, just from a professional background, many folks who end up visiting my practice often think that they're dealing with hypersexuality, but it turns out that they might just have higher sex drives than their partners. And so right off the bat, I can see an observation that hypersexuality is very much misunderstood by the general population on what it is. And what we look at when we see hypersexuality is that it really involves this overwhelming amount of sexual activity, this fixation on sex, and negative outcomes or negative effects that come from that. So, for instance, stress in relationships or at work because of this intense desire and fixation and action on sexual activity itself. And essentially, it's viewed as this concept of like a dysfunctional coping skill or an outlet. And that means that people who meet the classification of hypersexuality need to then get to the root of what are they trying to cope with? What are they trying to cope from, right? Like it's a maladaptive coping skill. Maladaptive means bad. And so it becomes important to note that then anyone can actually experience hypersexuality. It is a biggest pet peeve of mine, seeing in the literature how heavy it's focused on this concept of hypersexuality and ADHD, and the way the tones within the literature paints is that ADHD causes hypersexuality, which it does not. And I will repeat that probably more than once in this discussion. So this concentration on ADHD and the link to hypersexuality, it's depressing. Like, I'm just going to say it. It's depressing. And it's not an ADHD thing. ADHD doesn't cause it. When we look at the literature that has been published, like peer-reviewed empirical research, we see that hypersexuality seems to occur more in individuals with neurological disorders. So let's not then ignore disorders like Parkinson's disease, Alzheimer's. Now, also, people don't make fun of me. It's one of the words that I can't say for the life of me. I don't know why, so come at me if you have to. And also, part of those neurological-based disorders, TBIs, traumatic brain injuries. Now, let's critically think for a second, right? What is one thing that you think all of those have in common? You're no longer functioning typically anymore in a neurotypical world. That in itself becomes so fucking stressful. How many of us ADHDers know how stressful living in a neurotypical world is, with expectations that are not set up for our success? All of that, it leads to anxiety and depression depending on the person. And we also know that people will experience anxiety and depression quite differently, and some may find healthy coping skills while others may find unhealthy coping skills, right? That's just part of being human and who you are, depending on your protective factors, your upbringing, and your experiences. So I want to shift a focus over to sex. Like, how can sex become a coping skill? So if one turns to sex as a coping skill, where they then discover the chemical release that occurs, it becomes almost like medication that's helping anxiety or depression. And we know how powerful orgasms can be on effective management to anxiety or depression. An orgasm releases what we all call those feel-good hormones. You got the oxytocin, dopamine, and endorphins, which help a person's body become relaxed. It can improve mood. It can reduce the levels of your stress hormone called cortisol. What this does when you have an orgasm, it's making you feel safe. It's giving you this sense of well-being where you don't become paralyzed anymore by the stress or the tension that you're holding that's associated with the anxiety or the depression. This feeling, though, it's temporary. And so if something's temporary and you're liking it, you're going to want to keep doing it more and more. You're going to start thinking about it. And that's only talking about the individuals that have the predisposition or the risk factors that are piled up to be more perceptible to that, right? So again, this feeling being temporary, making you feel like a sense that you have it all there, it's going to motivate you, right? It's going to motivate the need for more because, again, it makes you feel safe. So this is how it can turn into hypersexuality, right? And there's always a line. And even with hypersexuality, you have to meet certain criteria to be considered hypersexual. So when we're talking about that effect of the orgasm and how it affects our mood, our feelings, this sense of safety, we know that orgasms affect, anxiety and depression because there was even an inquiry in looking at orgasms effects possibly being more beneficial to anxiety management, which again was an inquiry. And unfortunately, we don't necessarily have any empirical data as of now. And if I'm wrong, please shoot me an email because I have yet to see the literature. But I think it's important just to note and remind you that it's not something that is factual. However, we do know and we see correlations associated with that anxiety management and orgasms. But this is the part of the episode where I have to remind you, if you're dealing with anything medication, please consult a medical provider. Don't ever just assume that you don't have to do this or take this. If you're on medication, always consult your medical provider. So I feel compelled to say that. So getting back to hypersexuality, I'm not going to give statistics. And I know that's going to sound weird because I'm a researcher. I'm really big on, the research we have. But I choose not to because I know that these studies are not worldwide. They're not countrywide. And the numbers are definitely not big enough to generalize. So let's just leave it as research has seen a correlation, which is considered a relationship between ADHD and hypersexuality. Again, though, why is this? As a researcher, my brain runs fucking rampant on this. I begin to focus on all the effects of having any type of disorder can have on a person and how, again, healthy versus non-healthy coping skills can come into this. So keep in mind also that these studies operate off of self-reporting assessments on ADHD, which leaves a lot of room for error in knowing if the person actually has ADHD or are they dealing with trauma. Because we do know that trauma can present very similarly as ADHD symptoms. And when we're looking at an assessment, which I have to tell you something, these assessments out there aren't the best, and we're operating off of a self-report, that's a little flimsy. So the research on ADHD is very one-sided. Looking at all these negative experiences associated with our sexuality without any emphasis on one of the most important components in my professional and personal opinion is society, the social aspect. I can't tell you the amount of ableism that screams in much of the research by pointing to ADHD as this big bad wolf. The diagnosis. This shit can happen to anybody. And in my research, I'm investigating the effects of the environment on sexual satisfaction. I can't tell you how many clients I've freaking worked with who come in blaming ADHD for everything wrong in their lives. Fuck, I used to also do the same thing. And with this focus of environmental changes, how this dissatisfaction then begins to shift into satisfaction and self-acceptance and compassion is living proof that ADHD does not have to be the big bad wolf in the room, right? It still comes with its struggles. I still struggle. I will be the first to admit that there are mornings that I will wake up crying, even with my self-compassion and self-acceptance journey that I have taken upon myself. I have woken up some mornings where I'm overstimulated. My day is not set up for my success. I am dysregulated and I start just crying. And I have said the words. I have said those unfortunate words. I just wish I didn't have ADHD. So trust me, I am well aware that there is not necessarily a cure-all when it comes to feeling more satisfied in our sexuality as an ADHD or just in general in our day-to-day. Because guess what? That is not realistic for anybody. Everyone has good days and everyone has bad days. The same applies for an ADHDer, but we can definitely perpetuate a lot more good days if we focus on the things that can really lead us there. And in my professional practice and my clinical observations and the work I do, it is indeed this focusing in on the environmental piece, the social piece that leads to the shift from dissatisfaction to satisfaction, having more good days than bad days. Now, getting back to hypersexuality, because I could go on a fucking tangent there. If you believe you or your partner is experiencing hypersexuality, reach out to a qualified professional to begin exploring the concern. Typically, I would suggest seeing a sexologist or a certified sex therapist is a great place to start because most therapists do not have the qualifications or the background to be talking about anything sex related. And that's unfortunate. Even if you go to a marriage counselor, many marriage counselors do not get any training in sex. Thankfully, there are a lot of them that are going to get certified as sex therapists, which is wonderful. But anytime sex kind of gets brought up to therapists that don't have this background, they will probably refer out. So it's just best bet to cut, steps and go straight to a sexologist or a certified sex therapist. If you have ADHD, this is, I know, annoying. Finding someone who is competent in ADHD and doesn't then contradict the diagnosis by offering sentences and approaches that go against the fucking grain of executive functioning deficits that we have. I can't tell you how frustrating it is when somebody in our field says, I am an ADHD specialist, and then the shit that they're spewing while there's facts about ADHD in sentences and feedback, it's neurotypical in nature. It's not neurodiverse friendly at all by any means. So what I'm basically saying is try to find somebody that A, is a sexologist, a certified sex therapist, and also an ADHD expert that doesn't, contradict it. That's hard to find. I don't know a lot of them. I think I'm one of few. Okay? But it's important to reach out and get that support because if you're not the expert in the room, it's important to find the expert in the room. And if you're in a relationship, it will be important for you to go to someone who's also going to see you and your partner. Because guess what? If it's affecting you, it's affecting your partner. And working together side by unlearning all the misinformation society has shoved down our throats about sexuality that perpetuates the disconnect is so important. My mentor, name drop him right now, Dr. Ricky Siegel, he said once, and it stuck with me, it's something that he used to do with his clients when they would come in with sexual dysfunctions, is he would say, is this something your partner is aware of? And they would say yes. And he would then ask, is this something that affects your partner? Are they upset by it? Is there distress? Is there strain? Is there conflict? Yes. And he would then say, well, where then is your partner? Because guess what? One person cannot come into this therapeutic dynamic, right? While the other person is on the side. It's not fair nor realistic to put all the weight on one person. If you're a team, you're a team. You're going to do therapy as a team. You have to, because guess what? Your partner may be so uneducated on these topics, and they need challenges just as much as you. And to do that together not only builds growth and communication, but it also leads to solidifying that teamwork that you're trying to create. And I get it. At the end of the day, it's not easy to reach out. I do get it. There are so many crocs in our field. The vulnerability that it takes to reach out to somebody on these topics, it is hard. However, when we are sick, we don't try and pretend to play doctor. And it's more acceptable for you to go to a doctor. I mean, granted, we'll definitely go down the Google search hole. I'm sure. I know I sure as hell do. But you still end up going to the doctor. Because guess what? Society sees that as an acceptable start to finish process. Right? That's an expectation. You're sick, you go to the doctor. But what's the expectation on sex issues? Playtime issues. Oh, no. Keep that private, right? The expectation is quite different. Or shame gets placed upon it. There's so many unrealistic expectations attached to our sexuality. But we aren't the experts. And when I say we, I'm talking about you. I'm talking about the people that experience these things that are not the expert in the room. And even if you are, you're not going to be able to be your own therapist. I mean, there are things that, like, when it comes to ADHD and my daughter even, you know, I'm an ADHD expert, and there's a lot of things that I can definitely navigate on my own in my own home, but there are certain things that I'm too close to it emotionally. I might be blinded. I might not be seeing things as objectively as I need to be able to get me that support that's needed. And the same thing applies here. So if you're having any concerns in your relationships, your playtime, your ADHD, go to a qualified expert. I get it. It's an investment because most of us do not take insurance for a multitude of reasons. But it's an investment that promotes great return when you find the right fit. And if that person can help support you in your partner's goals in whatever they may be, that's fucking amazing. And there's nothing shameful about that. And so today's episode is really focusing on making sure we understand that hypersexuality, first of all, is not just talking about having a high sex drive. If you have a high sex drive and you're okay with it, guess what? You don't have hypersexuality. And I will also make a note that I've had people come in who are distressed by their high sex drive, but not because of it being a maladaptive coping skill, but because society has told them they're not supposed to want sex that much, or their partner has told them that there's something wrong with them, and that causes the distress. So hypersexuality, we're really talking about distressing effects in both relational and career that come from excessive thoughts and activity and obsessions around sexual behavior and activity. If that's not you, and you're just struggling within your sexuality, again, go see a therapist. Go get that support you deserve. Another thing I want to make sure we're all on the same page of is that hypersexuality is not something that is caused by ADHD. Don't let people make you believe that, because it's not true. The literature just does not support it. And while the literature and the research is very heavy on looking at all the negative outcomes us ADHDers experience within our sexuality, this shit can happen to anybody. And again, I'm going to bring it back to the one thing that ADHD, Parkinson's disease, Alzheimer's, again, I can't say the fucking word for the life of me, and a traumatic brain injury. All the same thing that is in common in that dynamic is that you no longer function, quote, typically. And that's distressing. And if you don't have support and you don't feel like you're being seen or heard or validated, and you feel like the other, and you don't have the correct support systems in place, of course you're going to reach out to unhealthy coping skills. That makes a whole lot of fucking sense. Now, that's not to say that there isn't something hormonal, dopamine, neurochemistry, whatever you want to call it, that could be causing or could be contributing to the interest, desire, outsource of, hypersexuality and other things. But at the end of the day, we don't know. So if we don't know, let's maybe stop focusing so much on a diagnosis as the culprit to a negative outcome. And let's also look then at the variables that come with having a diagnosis that separates us from neurotypical to neurodivergent, a diagnosis that has deficits in our executive function where our society demands proper, amazing use of. That brings a lot of stress. So it makes a lot of sense. And again, you're not broken. If you are struggling anywhere within your sexuality as an ADHDer, you are not broken. Your environment is the broken one. And your journey to self-compassion, self-acceptance, and learning what accommodations you need to mold that environment to be what it needs to be for you is the key to your success.